Imagine you just received a call from a nearby hospital saying that a loved one was in a severe accident and is currently residing in a nearby intensive care unit or ICU. When you arrive, you're instructed to sit in a waiting room, not being able to touch or hold or even see your loved one for a period of time. You have to put all your faith in both the ICU nurses and doctors and hope that they will be successful in helping your loved one recover. Every year, 5 million of these cases occur nationwide. Most ICU patients are on various blood pressure medications administered via infusion pumps. However, nurses currently do not have a time-efficient process for both adjusting and monitoring multiple patients' infusion pump settings. Nurses can spend up to 30 minutes in each of their patient rooms, both charting, monitoring, and adjusting multiple patients' infusion pump settings, even though protocol dictates that they should monitor each of their patient settings every 2 to 5 minutes at a time. After extensive research and prototyping, we have developed a novel solution, our mobile app-controlled infusion pump.
So let's take a look at some of the features of our Mac pump.
The Mac pump is a wirelessly enabled IV infusion pump that is controlled by a mobile app compatible with both iOS and Android devices. The app is specifically designed to monitor and control vasopressor drips that help patients reach a stable mean arterial pressure, or MAP. The app allows you to add a pump to a patient through pushing this plus symbol. Now a list of available pumps with their respective ID numbers will appear. A nurse can then choose which pump to connect to, and after connecting to the correct pump, the nurse enters the patient's name, and the medication is already preloaded into the pump itself. There's an initial suggestion given to the nurse based on the medication and the patient's current MAP. The nurse can choose to accept or decline the suggestion. If the suggestion is accepted, the pump will run at the suggested flow rate, and if the nurse declines this suggestion, they can manually input another flow rate. Updated suggestions will also appear if the patient's MAP is not achieving a stable range. And now we will turn on the pump completely wirelessly and both increase and decrease the flow rate. Nurses can also connect to and change the pump settings for multiple patients almost simultaneously. Here, we are controlling separate flow rates for 2 patients at the same time. When the pump settings are updated, the log function allows nurses to chart the patient's vitals and pump settings to the hospital's electronic health record, so that the nurses no longer have to do this manually. Finally, the nurses can see a live plot of the patient's MAP versus time, as well as their arterial waveform for even better monitoring. With these novel suggestion and wireless control features making the titration process more time efficient for ICU nurses, our Mac pump has the potential to become a standard in the ICU. This offers an immense market value to hospitals and nurses, as demonstrated in the following case study.
We have a hypotensive patient whose MAP is too low.
We'll use our app to receive a suggestion of 3.75 milliliters per hour of epinephrine for this patient's initial drip rate so that their blood pressure may rise up to a stable level. We'll use our app to take the suggestion and wirelessly update this patient's drip rate.
Now let's take a look at our other patient here who is hypertensive. His MAP is too high.
We'll take another suggestion from our app and set this patient's initial drip rate to 11.25 milliliters per hour of nitrine, which serves to lower this patient's mean arterial pressure back to a stable range. And while we're actually at the second patient, we can take a look back at our first patient, and we see that their blood pressure has still not achieved a stable rate yet. So we'll take yet another suggestion from our app and increase this patient's adrenaline to 7.72 milliliters per hour.
As our patient's MAP start to stabilize, we hope to titrate our patients back down to 0 based on our app suggestions.
As you can see, with our Mac pump, nurses will be able to save valuable time, more time in which they can help our loved ones recover faster.